Kia ora, welcome to the Diabetes and Pregnancy Talk. Today we're going to talk about gestational diabetes and how it affects your pregnancy and outcomes for mums and babies. So diabetes is a hormone that is made from the pancreas, and the pancreas is an organ that sits just below your stomach, and it releases insulin to help keep your blood glucose balanced. So if you don't have enough insulin being released, that's when you get too much glucose in your bloodstream. So some of you may have had a blood test at the lab that involved having a sweet drink and sitting there for a couple of hours, or some of you may have just had a blood test early in your pregnancy that detects that the levels of sugar are a little bit too high in your blood. So that's why you've been referred through to our service to give you some help for managing your diabetes in pregnancy. So there's lots of different reasons for gestational diabetes. We know that it's a temporary form of diabetes and it will go away after you've had your baby. Gestational diabetes occurs when those levels of sugar in your bloodstream are too high, either by that blood test that I just mentioned about, or perhaps you've started doing some monitoring of your blood sugar levels. When you're pregnant, you need about 3 times the amount of insulin than when you're not having a baby. So the demands on your body are very high. So this can impact why the pregnancy diabetes happens, is because the requirements are a lot higher when you're pregnant for insulin needs. So here I'm going to show you a graph of the insulin requirements when you're pregnant, and we can see that when you get to about 24 weeks pregnant, which is about 6 months of pregnancy, that your body is starting to need a lot more insulin. So if your body's not able to keep up with making all this extra insulin, there's a bit of a shortfall. So that's where we can help you during your pregnancy with a shortfall of insulin. So some of the risk factors for developing gestational diabetes are if you've had gestational diabetes before. If you're older and you're having your first baby at age over 30, then you're more at risk because your pancreas has already been working for 30 years, so it's a little bit more tired than it would have been if you were having your baby in your 20s. Different ethnicities, non-European people, women are more at risk of getting pregnancy diabetes. And if you've gone into your pregnancy with a bit more weight when you started your pregnancy, obviously your body's been working a little bit harder at the beginning. So that puts your body a little bit more at risk to start with. However, also what can happen is if your pregnancy weight gain is above the recommended amount, then that also puts extra pressure on your body. If you have a family history of diabetes in your family, then unfortunately you are at an increased risk for developing gestational diabetes as well. There's a syndrome called polycystic ovaries that women can have. If you did have this syndrome, then you would know you have it. Sometimes women have trouble conceiving and have trouble with weight gain. So these women also are at more risk of getting gestational diabetes. And if you've had neonatal losses or lots of miscarriages, or even if you've lost a baby in the past, perhaps that may have been due to diabetes that may have got missed and not recognised early. So these are some of the risks that we would look at for diagnosing gestational diabetes.